Hello, and welcome to Healthcare Matters, where thought leaders come to discuss the intersection of medicine and the law. I'm your host, Mike Matre, and today's guest is Dr. Jonathan Terry. Dr. Terry is a board-certified osteopathic physician and surgeon, as well as a general psychiatrist. Welcome to Healthcare Matters, Dr. Terry.
Thanks so much, Mike. I really appreciate the invitation to be on the show.
One of the most important elements of ethical care is to get informed consent from your patient prior to beginning any course of treatment. Is it more difficult to achieve informed consent via telemedicine setting than a traditional office setting? And if so, how should a physician practicing telemedicine alter his or her approach to achieving informed consent?
Informed consent is something we think a lot about with telemedicine. So I think it's easiest if we look at getting informed consent for telemedicine in a similar way that we'd look at it for any other procedure. So what I mean by this is that there's a precedent for having a separate consent form or an electronic form specifically authorizing the use of telemedicine. Usually this form will outline the risks and benefits specifically of telemedicine and specifically say that the patient has the right, of course, to decline telemedicine at any time. It's also, I think, a good idea as we're using electronic methods to have some type of privacy policy stating specifically how's this information going to be used, how will it be transmitted, maybe how will it be stored, as well as any potential security breaches that might be inherent to the software or the transmission.
Thank you for your time, Dr. Terry.
My pleasure, Mike. Thanks so much for having me on board.
How do best practices for entering data into a medical record when it's acquired via telemedicine as opposed to face-to-face encounter differ?